name's Dr. Juyia, a board-certified OBGYN, and today we're going to talk about dilation and curettage, more commonly known as a DNC.
Dr. Juyia, what is a DNC?
DNC is the term for a dilation and curettage, which traditionally is opening the cervix while a patient is asleep and removing the contents of the uterus for numerous reasons.
Can a DNC help me with heavy bleeding?
A DNC can help with emergent heavy bleeding, but it doesn't change the reason for most heavy bleeding, meaning if it's a hormonal issue, it will not fix the next cycle.
Do I have to have a DNC after a miscarriage?
Unfortunately, a lot of women experience at least one miscarriage in their life. You do not always have to have a DNC after a loss.
Is a DNC considered a major surgery?
A DNC is not considered a major surgery. However, it's understandable if a patient feels that it is major.
How is a DNC performed?
A dilation and curettage traditionally is performed by dilating or opening the cervix and then scraping the uterus. However, the more modern way to do this is under the direct visualization with a hysteroscope.
How can I prepare for my DNC?
You can prepare for your dilation and curettage the way you would prepare for any procedure at a hospital. You should stop smoking as soon as possible. You would arrive at the hospital when recommended and stop blood thinners perhaps a few days in advance.
What can I expect on the day of my procedure?
On the day of your surgery, you can expect to be asked to arrive at your procedure center approximately 2 hours before your scheduled procedure. This gives you time to meet with your anesthesiologist and your nurse, and you'll get an IV and perhaps some blood drawn.
What is the recovery like after my procedure?
The recovery after a DNC is rapid, usually some cramping for a day or two, and most of my patients are back to work the next week.
What are the risks involved with a DNC?
There are risks with any surgery, including with a DNC. Specifically to this would be bleeding. Often a DNC, however, is to treat bleeding. Infection, which is very rare and we watch for afterwards, and injury to the uterus, which could include poking a hole in the uterus. Usually this will heal without further intervention. To learn more about our practice, please give us a call or visit our website or Facebook page.